We're turning 5 on your health tonight, and President Trump has announced a new round of tariffs, including up to 100% on some imported drugs. On social media yesterday, the president said that the import tax will apply to any branded or patented medication unless the company is building a manufacturing center here in the United States. And right now it's unclear if companies with existing U.S. manufacturing will be spared from that. Drugs made in the EU will be subject to 15% tariffs. So joining us right now to talk about all this, how this will impact, the tariffs will impact patients, is Dr. Todd Heller, South Shore Health. Great to see you.
Great to see you.
Happy Friday. Great. So let's talk about this tariff on brand name prescription drugs imported from other countries. It's scheduled to start Wednesday, right? So just right around the corner. How could it impact patients?
Well, first of all, I don't want anyone to panic. Why? Because generic drugs, which make up 90% of our prescriptions, will likely be exempt from this. So that's important. That's why we don't have to panic. But if you have a branded drug, I mean, it's possible that this could, affect consumers. We really don't know. I mean, pricing of drugs in the United States is really complex. Things have to do with pharmaceutical company, shareholders and insurance plans and government rebates. So there's lots of things that go into it. Could this ultimately affect supply of medications? It's possible. Could there be issues, with I just think ultimately we shouldn't panic right now. We can't predict everything.
Do doctors worry about the cost of drugs?
Of course we do.
Yeah.
Of course we do. One of the most important things that I can do is make sure that my patients are taking the medications.
Right.
We care about availability, accessibility, things like that. So, but I think the bottom line is this. It's not clear that this is going to change that at all. I want to tell you something. So I've had HIV patients I've been treating all my life, right? And in the beginning, in the 80s, we had no medications. And then in the mid-90s, so about 30 years ago, the cocktail came. These are very expensive medications. And Massachusetts it's one of the states in the country that has done the best job at making sure our patients get these medications, one way or the other.
Is there anything that patients can do even now to prepare for this? Is there anything that patients can do?
I think, first of all, remember, generics are unlikely going to be touched.
Yeah.
Other things, you can speak to your provider, you can speak to your pharmacist. There are things that can be done to lower costs.
Yeah.
One of them is to ask your provider, are there generics that are around? Another thing, sometimes 3-month mail orders can be less expensive than going to the pharmacy. And there are ways of looking online. Insurance plans can look and can see, pricing online. So there's ways that patients can use the internet.
But you can hear the I'm going to use the word fear. It's not the right word, but you can hear people reacting when they hear 100% tariff. They go, oh my goodness, 100% tariff.
Right, and they have to understand that does not necessarily mean that their medication is going to go up 100%. It's just way too early. Okay, and again, for those pharmaceutical companies that are manufacturing in the United States, those drug pricing won't be touched. It's a way of trying to get more manufacturing into the U.S. Yes, there's a lot of importing that we do, but the hope over time is that won't affect the bottom line. I think ultimately, remember, take medications. I don't think we have to hoard necessarily meds like that. Don't panic.
Great to see you.
Good to see you, Eddie.